A legislative breakthrough on Medicaid and the state budget this week, but there's still a long ways to go before a final resolution.
I don't think anybody should feel like this should have hurried up. This is a this is the largest expansion of a government program that I'm aware of in Arizona state history.
That's State House Speaker Andy Tobin, who wants to take Medicaid to the voters in a special election, which would negate Thursday's Senate passage of a state budget that includes Medicaid expansion. Does the idea of going to the ballot have a chance?
I think it would be a waste of time in that, for example, Proposition 204, it provides, the voters approved this initiative twice, and it finally became law in 2000. It's been approved.
Sorting out what happened and what's next in the Medicaid battle. It's Arizona Week.
Production of Arizona Week is made possible in parts by a grant from the Stonewall Foundation and by the members of Arizona Public Media. Thank you for your continued support. Once again, your moderator, Michael Chihak.
The Arizona Senate gave Governor Jan Brewer a victory in the first battle over Medicaid expansion this week, with 6 Republicans joining all 13 Democrats for passage on a 19-11 vote. We were there for the day-long debate on Thursday.
Thank you, Mr. Chairman. I move that the McComish floor amendment to Senate Bill 1492 be adopted.
Floor amendment number 1, just to be...
McComish floor amendment number 1.
Thank you. And a brief explanation.
Thank you, Mr. Chairman. The floor amendment expands the Arizona health care cost containment system population by increasing the eligibility level to include individuals whose household's modified adjusted gross income is more than 100% of the federal poverty level, but equal to 133% of the federal poverty level, effective January 1st, 2014.
Majority Leader McComish led the breakaway from Republican opposition to Medicaid expansion, proposing his amendment as part of the state budget. The amendment matched most of the governor's proposal to expand Medicaid coverage to another 300,000 poor Arizonans by accepting billions in federal matching money under the Affordable Care Act. Passage came despite strong opposition led by Senate President Andy Biggs, who proposed 11 amendments in an attempt to kill the proposal.
Mr. Chairman, I move that the Biggs floor amendment number 1 to the McComish floor amendment be adopted.
And a brief explanation, please.
Amendment repeals Medicaid expansion program as of January 1st, 2017.
Just 2 of Biggs' amendments passed, including one that would sunset the Medicaid expansion in 3 years. Democrats remained united on every vote, although they had little to say in the debate. Instead, they worked the floor with their newfound Republican allies, leaving it to GOP senators to make sharply drawn arguments.
I'm going to go ahead and give my 2 cents right now, because this is the expansion bill, and this is the thing that I was elected to come down here and oppose. Oppose Obamacare, and oppose any part of Obamacare, which Medicaid expansion is one of the 3 legs that Obamacare stands on, and I oppose it. As the only person in this body who has functioned as a practicing physician and a patient and a health policy expert and a director of medical education, my experience is vast and different from any of the rest of you.
As she noted, Ward is the only physician in the Senate, and while she spoke from that position of authority, she also raised many of the political arguments against the expansion and against the Affordable Care Act.
Fact. We can maintain coverage for those currently in the Prop 204 population through at least next year. We do have time. Fact. There's no evidence that Medicaid coverage improves patient outcomes over the people that are uninsured. We have time. Fact. There's going to be drift or shift from the well-insured to the Access Medicaid program for many people currently that are at 138% of the federal poverty level. So we have to take our time. Fact, Arizona has voted not to accept Obamacare. This is Obamacare. We must take time.
First of all, I think that many, if not all of us, recognize that we're faced with 2 unpleasant choices, and when we must decide. We don't have choice 3, 4, 5, or 6. We have one of 2. Either we do the Medicaid expansion or we don't. Those are the 2 choices. Those who oppose it are saying that in the out years, the money's going to go away, and we're not going to be able to afford this, et cetera. And, I don't think anybody knows that. They may be right. They may not be right.
Republican Senator Don Shooter of Yuma summed up his side's opposition with this warning about both the financial implications of expanding Medicaid and the need to fix the system.
But I think the system has become far too expansive, and we've gotten to a stage where the people that are having their health care provided for them are receiving better health care in some cases than the poor people out there paying the bills. So this is a significant problem. It is a problem that we need to look to solve in the future.
The Senate's vote sends the budget, including Medicaid expansion, to the State House for deliberation next week. There, an entirely different scenario awaits. I interviewed House Speaker Andy Tobin on what he hopes to accomplish. You've proposed that the Medicaid expansion be put before the voters.
Yeah.
Talk about your rationale on that.
Well, there's several issues that I'm very concerned about. First off, I believe, as you were aware, the Prop 108 requires a 2/3 vote if you're talking about an increase in taxes. Now, I know that some lawyers say it's not a 108, which the governor's language probably isn't, but that's already being changed, as you've mentioned earlier before we started. And the changes that I'm looking to make with making sure that we have protections in there, I believe it certainly makes it a 108. That's a 2/3 vote. I don't believe that 2/3 gets here, but that could happen. So it's my view is that rather than have a potential of having a lawsuit, that we should seriously consider that this should go to the voters for the assessment. The assessment is not insignificant, but it's also very different from the governor's assessment.
And the assessment you refer to is the assessment against
Download
hospitals?
Yeah, that's right, where they tax themselves. The other concern about going to the voters is this assessment, once again, is under the guidance of one bureaucrat, the director of access. They have the ability to raise or lower that. Now, our director of access has been very helpful and cooperative, and we've kind of walked hand in hand. You can't prove that that's going to be the case going forward. Maybe he's not in charge. Maybe a different governor's in charge. We don't really know. Nonetheless, I see that as a separation of powers issue. When we bypass 108, which has happened many times down here, it's usually because we have what we call a may instead of a shall. You may increase your fees to the campground by $10. You may increase your fees on this association by $10. It doesn't hit the 108 mark because we're giving authority to somebody else to possibly do it. In this movement for this expansion of Medicaid with such a large assessment required, I believe that creates a higher standard, and we should go look there first. And I also believe that having one person in charge of that assessment makes that person an appropriator, which is what the legislature was supposed to be. So I think we have legal issues, which is why we need to go to the voters on those 2 points especially.
And how did you come up with this? Was it through exploration of what the governor's proposal was, or how? Because it's been a while since it's been out there.
Well, I appreciate it hasn't been a while. The governor came out on January 15th, and then in the middle of February, we actually got the language. We're in the middle of May. I don't think anybody should feel like this should have hurried up. This is this is the largest expansion of a government program that I'm aware of in Arizona state history. I went back to Washington, D.C. I got a chance to visit and meet very briefly with Secretary Sebelius, met with others who are Governor Dean, but Governor Haley Barbour. Governor Dean opposed Obamacare. He opposed Obamacare because it was fee for service, as far as he could see in many of these states, rather than managed care, which is what we do here. So I had a nice conversation with him and learned some things that he spoke about in his speech. So I think the answer is I think the voters expect you to take time dotting your I's and crossing your T's and coming up with solutions. And I've been meeting with members and stakeholders, and so this is what I got out of those meetings. And the biggest pieces are, what problem are we trying to solve? The problem we're trying to solve is to make health insurance affordable. That's the problem we're trying to solve. The governor's plan, in my view, didn't do that as well as mine does, and I'll tell you why. The governor's plan, while drawing down dollars to a very desperate hospital corps who's desperate for resources because of this possible expansion and the uninsured, is right to have jumped on board because they really had no other option. I believe I've created another option. I allow them to draw down more dollars so that they can at least do two things. One thing is actually pay for the tax that they're taxing themselves. It's a lot of money. The other thing that they can draw down dollars to backfill the cuts that they've had over the last several years. Then we agree with the governor.
Ultimately, this becomes a political decision
Yeah.
by the legislature. And you'll expect to get a budget from the Senate that includes the Medicaid expansion. What will be the first steps for you next week when you have that?
Well, the answer is I haven't read, and I usually don't. I usually wait for the Senate to get done with whatever they're doing. Usually we move together. This time we're not. So rather than to start studying up on what could change a half dozen times, I really haven't reviewed what they have. So when that comes over, I'll review it. We'll see what they put in it. My guess is that they were talking about some of the options that I just described to you. We'll see if they get there. The big pushback that I've heard from my piece was we don't want to go to the voters, and that's the largest pushback. That's not to say there aren't some more pieces that we have to fix, but I recognize that I could be wrong. Maybe someone else's attorney is right, and it's not a 108, but I believe it is, and I believe it's not worth the risk of being sued over it and not being able to move this agenda forward. So I think I'm right, but we'll see. So I'm anxious to see what the Senate's done with, and anxious to see what budget they're finished up with.
Some members of the House have talked about the idea of taking your idea to go to the voters, but making that a legislative process instead. Would that
Sure.
work?
Well, the answer is I wanted to put back out there in the public domain and for the House lawmakers, because many of them broach these ideas. That's kind of what's happened here. And I think that I know we have a lot more support for this piece that I presented that truly solves a problem. And my door is wide open. I've been meeting with Republicans and Democrats over this issue now for months. I think at the end of the day, we're going to try to find that sweet spot, because I don't think anybody wants to see this overturned in court. And I think the members are seeing that, for heaven's sakes, there is reason for concern, and maybe we should go this way. But, I certainly haven't been counting votes on this. I'm trying to give it some breathing room and see what folks are coming up with.
Tobin noted that his chamber has done a good bit of work on the state budget for next fiscal year, but all of it is overshadowed by the need to deal with the governor's Medicaid proposal. How much work had the House been doing on a state budget up to this point?
Oh my! Well, the House, we had small groups on this several months ago. We did several with our members, and up until last week or 2 weeks ago, the governor's staff, House and Senate staff had been narrowing the budget together. We weren't that far off. We haven't been that far off for months. There's a lot of support for the priorities that the executive presented. They're similar to our own: more funding for K-12, the CPS crisis. So there's widespread agreement that we want to be putting. It's just a question of what those dollar amounts will be. So
if there is a legislative solution to the Medicaid expansion, does that free up general fund money that could be used elsewhere?
Well, if we have the assessment tied to it, it does. If there's no assessment, no, it doesn't. But that could free up some dollars, and I believe that those dollars should be used to either pay off debt and/or maybe pay off some debt and set aside additional money in the rainy day fund in case what I believe the federal government will eventually start cutting back from this support. And I think as they cut back, we needed higher circuit breakers. I think you heard the governor talk about circuit breakers. I made my circuit breakers tighter. And the last piece of my legislation is that we sunset the whole thing in 2018. So what we're saying is that I'm so sure that this is going to fall apart that I don't want our lawmakers coming back in and being forced to take people off of Medicare or Medicaid, and they shouldn't be put in that spot. If this is a program that is paid for by the federal government, by and large, most of it, then if the federal government cuts it, then they're the ones who should be taking people off. So that's why the sunset's there. However, if in fact the program's working, and if in fact the shift to the business community is not there, basically what we've accomplished is we've drawn down federal money that you and I both agree is all borrowed because there's no extra money there. So we've drawn down federal money and handed it back to our taxpayers in the form of control over increasing premiums. And I think that's a significant part of it. So if I have that component and I have savings in the form of reducing Arizona's debt, I think we have a better plan that we can say, look, we're using federal dollars to assist with our taxpayers and assist with paying down state debt.
There are those in the Republican caucus who would say no federal infusion because it is borrowed money. Instead, let the free market figure this out.
Yeah. Well, I think they're right. I mean, I'm not a fan of expanding government. I think that, however, we do take federal money. We do it all the time, mostly because it's Arizona money, whether it be highways or other pieces out there. So I'm as concerned as they are, which is why you have a sunset in it, which is why you can almost consider this, my plan anyway, to be maybe the largest pilot program in Arizona history, where we get to spend the next several years finding out, okay, did it work? Did we do it the right way? What wasn't done right? And did the feds keep up their promise? And if they didn't, this thing just ends, so Arizona's taxpayers aren't on the hook for it. I like that. I believe that that better protects the Arizona taxpayer.
Is Republican unity at risk in all of this?
Yeah.
Because there are people all over the spectrum of support or opposition.
Well, yeah, and that's always an issue. You know, we had a conversation about a sales tax issue, 3 years ago. I promised, the governor promised, that Prop 100 would go away. And of course, the argument was nobody believed it. Well, as I recall, we didn't lose any Republicans over Prop 100. In fact, we expanded our majority here, if you'll recall. And right now, I don't believe we're going to lose any Republicans. This is truly a fight at the heart of our base. And however, as you look at the alternatives for the budget process, I struggle with saying it's okay as a conservative Republican, fiscal conservative Republican, that I should spend my rainy day money on the protections of a Medicaid system that loses the cap from the Fed. So those 60,000 people, if in fact the Feds are sincere, they're going to not continue the waiver come January, we have to pay for that. I feel compelled to say, well, I don't want to use our rainy day money. We work very hard to have that rainy day money set aside. It improves our credit rating. It gives us some flexibility in low economic times and struggling, which is where we are right now. So while it's true that members should be, in our base should be concerned about that, I think they should look at what my plan says. It says, here's what we have. This is a way to help bring down some more Arizona dollars. They're Arizona dollars. Remember, Obamacare started in January taxing people for medical devices, things like that. They cut reimbursement to Medicare. It's going to cost Arizonans more money. So my view is that as the federal government is taking more out of Arizona, I'm actually bringing it down, bringing more of it down, but I'm turning it back into Arizonans in the form of hopefully reduced premiums on their health insurance and also reducing the debt, which, by the way, is costing us $1 million a day.
With the focus now on the House of Representatives, I spoke with several members about the coming debate. Tell us your stance on the Medicaid expansion.
I oppose the Medicaid expansion for a few reasons. It started off with the life issue. Now, I initially stood out there with the governor because, I believe that it would help folks that need cancer treatment, surgeries, and just procedures they couldn't, of course, pay for on their own. Then I come to find out that an increase from 100% federal poverty level to 138%, right now Arizona is mandated we have to fund abortion providers. That number would necessarily increase, and I can't support that.
I believe that all Arizonans should have access to affordable, quality health care. So I'd like to see it move forward, but at this time I'm wanting to see what comes out from the Senate, and then there'll be further discussions on that. But I do support the concept of Medicaid.
I think that the real key here is that the voters under Proposition 204 10 years ago, basically in 2 elections, have mandated that folks be covered if they're at the poverty level or below. It's my obligation when I swear to uphold the Constitution of the state of Arizona that I follow through with what the voters have done. Now, obviously, during tough economic times of 2008, 2009 into 2010, a portion of that population was frozen. And we have a court case that decided that was okay to do so. However, we have funds available in the future. If we pass a budget that does not have Medicaid expansion, I would imagine there would be a lawsuit that would be filed very shortly thereafter and say that, well, the state of Arizona, you now have funds. We need to fully fund Prop 204. And this is where we get into, well, if we're going to fully fund at 100% of the poverty level at the matching rate that we get from the federal government, if we go to 133, then we get a much better matching rate from the feds. Then this is where this whole question comes from.
I'm in full support of Medicaid expansion. I'm a part, my family's a part of working families in Arizona. The first day I started my walk in running for this position, my neighbors shared their story with me, thus representing the need in my district. But the fact that they were retired, childless adults, fell through the cracks and didn't qualify for health insurance, and were uninsured. Both suffered heart attacks and had to find their own means to get their medication and the service.
And the expansion would cover folks like that, correct?
It would.
And thus your rationale for supporting it is that there are people out there, by the governor's count, hundreds of thousands who need this coverage.
Right. Childless adults are in there, but there's a lot more for folks that would qualify or qualify that are not able to get access to affordable health care right now. That's my district. We're working families.
Your opposition to the Medicaid expansion starts with the notion that it would allow the funding of abortions?
Correct.
Okay.
It would technically, there's a federal law that says tax dollars cannot go towards directly funding abortions, but any increase in funding that goes to abortion providers I'm concerned with, because that's indirect funding of abortions.
Do you see that a way that the law could be amended to take care of that issue that you have?
There's no state legislative fix. The problem lies with Medicaid. And any state that has tried to remove dollars going towards abortion providers or just health and wellness services, they've been sued by the federal government.
Does this mean that you also would be opposed to the Medicaid expansion going onto the ballot, as
Yes.
Speaker Tobin is suggesting?
Yeah, I oppose that as well.
I don't like that idea, and I don't think that should move forward. And even though I appreciate Speaker Tobin's his try on that, I don't want it to go to the voters. I don't see me supporting that.
A lot of things get taken to the voters, a lot of big decisions, and I'm not fully opposed to ever doing that, and I'm not fully opposed to what the Speaker is attempting to do. I think that he brings up in his referral plan, the language that's in there, a lot of good points on things that can be incorporated into a broad bill with expansion, or whether it's part of the budget this year, and so it cannot be discounted. However, I believe in this issue, in this instance, I don't know that Medicaid expansion, we've already got Prop 204 enshrined as Voter Protected Act. I'm not so certain that I would like to enshrine Medicaid expansion as a Voter Protected Act either. That would be very cumbersome, very difficult to amend at a later date unless we go back out to the voters.
I think it would be a waste of time in that, for example, Proposition 204, it provides, the voters approved this initiative twice, and it finally became law in 2000. It's been approved. I don't know how much more we need to keep going back to the voters on this issue. I think we've got to do the right thing. And I think we ought to provide our Arizonans affordable health care.
Do you think it'll go to the ballot? Do you think there will be passage of a state budget by the legislature that includes the Medicaid expansion? How do you see that going based on your knowledge now?
What I would like to do is work towards a common sense budget that includes the Medicaid expansion. Medicaid expansion would actually benefit a lot of my district. A big portion of my legislative district too is rural, and this expansion would actually help clinics and hospitals stay open, because if you really think about it, having healthy citizens will actually build our economy.
I am hoping that the end product will reflect the need and that urgency to provide health care coverage to Arizonans. I'm hoping that in that conversation, however drawn out it has to be, that a good dialogue takes place, and that the end product will be that Arizonans will get affordable health care.
If the only way they can get it is by taking an issue such as this to the ballot, would you vote for that?
I think I need to hear more. But if in fact that is going to be the most viable solution, then I'd be in favor of taking it back to the voters. Only because I know where the voters stand on this issue, and I'm confident that to me, it's like I said, it's just a waste of time. That's sadly something that Arizona has to keep paying for.
My count, I think they have 31 or 32 votes, so I think it ultimately goes.
I imagine there'll be a floor fight to ensure that it's part of the budget in the House side before it gets sent on over to the governor. I think that Speaker Tobin's option on referral is actually very good to have on the table, because should things break down, should expansion not have the votes to pass, you need to have a plan B ready to go just in case. And I think that what he's done is given us a slight different course where we can say, okay, well, we tried here and there. This is one last option that we can try.
You can keep up with this story on our website, azpm.org, on NPR 89.1, and AZ Illustrated on PBS 6. Next week, we'll visit with Governor Jan Brewer for her take on the Medicaid debate. That's our program for Friday, May 17th, 2013. For Arizona Week, I'm Michael Chihak.
Production of Arizona Week is made possible in parts by a grant from the Stonewall Foundation and by the members of Arizona Public Media. Thank you for your continued support.